Thousands of health interventions exist today that save and improve lives, but with limited budgets, governments need to choose which intervention to invest in and how. Using evidence can help tackle this challenge in several ways, from prioritization of health technologies to procurement and price negotiation to monitoring and evaluation. This is a continuous and cyclical process working like a feedback loop, helping us reevaluate resource allocation decisions in the light of new evidence. The first step in this process is prioritization, which aims to maximize population health with given resources in a fair and equitable manner. To achieve this, evidence from health technology assessment can help guide decisions. Then, the government will need to procure technologies at the price that provides the best value for money. Negotiation using evidence from cost effectiveness and budget impact analysis. Finally, a monitoring and evaluation system is required to assess if the technology is delivering the intended impact using data registry or other means. This feedback can help reprioritize resources and improve service delivery in the future. As you can see, the process works like a loop driven by the use of evidence. Let's tie this together with a case study of treatment options for end-stage renal disease in Thailand. When it comes to prioritization, conducting studies on severity of disease, cost of illness, or equity and access provided evidence that helped us identify and justify why renal replacement therapy for end-stage renal disease patients should be considered for inclusion into the Universal Coverage Scheme. A cost-effectiveness analysis of treatment options found peritoneal dialysis first policy to provide the best value for money compared to hemodialysis first policy or palliative care. The use of evidence doesn't just stop there. Through the budget impact analysis of renal replacement therapy for end-stage renal disease patients in the Universal Coverage Scheme, we found that it would consume around 15% of the total national health insurance budget by the 15th year of implementation. And the government used this evidence to negotiate the dialysis solution prices, ensuring financial sustainability with bulk buying and the reduction of the unit cost of dialysis solutions. By using all the evidence, Thailand managed to get the best value for money and finally introduced the PD First policy, bringing an essential care to people provided free of charge. To create a feedback loop and enable a cyclical process of using evidence, the government also created the Thailand Renal Replacement Therapy Registry. Through this monitoring and evaluation system, we found evidence suggesting that access to this free service was still a challenge in the remote parts of Thailand. The government then used this information to allow patients to perform dialysis in their homes by delivering dialysis solutions via the post. This helped ensure the policy was meeting the needs of the patients. And this is just one of the many examples demonstrating the benefits of using evidence to address healthcare challenges. As shown in our example, when new evidence, interventions, or ways of delivering existing services become available, decisions must be revisited. Therefore, using evidence for healthcare resource mobilization should be a continual process and not a one-off decision. Addressing end-stage renal disease remains an important issue for many countries, and we have seen similar evidence-informed dialysis policy being adopted in other countries, including the Philippines and Indonesia. The practice of evidence-informed policy making and lessons from other countries can ensure that a country's progress towards universal health coverage is equitable and sustainable. HITAP is working with the Access and Delivery Partnership to support low and middle-income countries in strengthening their capacity to systematically use health technology assessment to address healthcare challenges. You can find out more by visiting our website.